Plantar fasciitis is a very common cause of foot and heel pain in the general population, but it's also common among military service members and veterans. In this video, I'll discuss plantar fasciitis, its symptoms, treatments, and some of the causes. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service, so you get the compensation you deserve. Plantar fasciitis is a foot condition that results from sort of a degenerative irritation or a degenerative condition involving what's called the plantar fascia origin at the calcaneal tuberosity. So what that means, like if you look at the heel bone and where it attaches, you don't see the plantar fascia on here, you just see the bones, but the plantar fascia is this band of tissue that basically holds up the arch. And you typically get pain along the heel bone, sort of on the plantar surface, the sole of the foot, and on the medial side, the side close to the midline of your body. Now, that plantar fascia plays an important role in the normal way your foot works, sort of the biomechanics of the foot. It provides support for the arch, and it's also important for shock absorption. Now, the cause of plantar fasciitis, there's lots of causes. Typically, though, it's an overuse type of stress. What you're typically going to have is a very sharp pain at the heel. Now, 50% of those people also have heel spurs, but the heel spurs are not actually the cause of plantar fasciitis. And you can have heel spurs and not have plantar fasciitis, and you can have plantar fasciitis and not have heel spurs. We think that the spurs themselves have no role in the course of the disease. But like I said, it's typically an overuse injury, and it's usually a repetitive strain that causes microscopic tears in that plantar fascia. Now, it can be the result of trauma or a number of other causes. You can be predisposed to it through things like pes planus or flat foot, pes cavus, which is a really high arch, a lack of ankle range of motion, specifically dorsiflexion, or too much pronation and supination. The flat foot is the one that I see so often with people in the military and veterans, and that pes planus causes increased strain where the plantar fascia comes off the heel bone. You see this often in runners, which makes it really common in the military where you have to do a lot of running and training, but it can also involve things like obesity, aging, occupations where you're standing and weight bearing for a long period of time, like the military. Typically, the pain gets worse and worse at the heel. In severe cases, that pain can radiate up the foot and up into the leg. Usually that pain is worse first thing in the morning, the first few steps out of bed in the morning. Long periods of standing or sitting sometimes can do it as well. Typically, it gets better the more you've been walking and as you start physical activity, but then the pain can get worse throughout the day. If you have ideas for future videos for this channel, whether those injuries, risk factors, specifics about DBQs or Nexus letters, or really anything, leave those in the comments below this video. Make sure to subscribe to this channel so that you can watch any new videos I release. If you're interested in a Nexus letter for your injury or condition, click the link in the description below this video to learn more about working with me and my team. We do everything we can to make the process as easy and as quick as we can for you, and I try to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to working with you more.